Good afternoon, everyone. I'm Matt Power, Chief Administrative Officer for Arundel County. Welcome to our Confronting COVID Forum. Today, we have a forum focused on mental health and how to increase your resilience. As the pandemic has continued on, it's taking its toll on everyone more and more each day. We thought it would be good to have a forum focused on resources available throughout the county, as well as tips and help getting through what turns out to be a rougher and longer time period than any of us anticipated back in the spring. I'm joined today by the county executive, by Dr. Kelly Raman, our health officer, by Adrian Mickler, who is the head of the Anne Arundel County Mental Health Agency, by Catherine Gray, who is a mental health director, and Karen Carney, who is an esteemed social psychologist. We also have Kay Boguster Brown, who is our chief of staff, and Pam Jordan, our Deputy Chief Administrative Officer for Health and Human Services. We look forward to an interesting and lively discussion. As we always do in the Confronting COVID forums, we're going to kick it off with Dr. Kellyanne Rahman running us through the latest COVID numbers and updates. Dr. Kellyanne Rahman?
Thank you, Matt. Thank you, County Executive. I will share my screen, so give me a second. Oops, that's not the share. That's what I need to do. So I just wanted to take a few moments to talk about where we are as a county and talk about the implications of that on our health and the rationale for some of the actions that we've taken. So as always, starting with the principles, the goal is to eliminate the virus to keep people healthy and prevent illness and death, to allow schools to open, to keep businesses open, and critically, as we're talking about today, to promote mental and social well-being. And the critical part is that public health measures are the roadmap for more sustainable recovery. And so it's been a year now since the virus was first discovered, and we now have a vaccine 1 year later, which is an amazing feat. But in that time in our county, we've had over 20,000 cases and 306 deaths and counting. In fact, present time, it's the fourth leading cause of death in Anne Arundel County and the third leading cause of death in the United States. This is in the context of all the restrictions that have been put into place, and I think it's a marker of how severe this disease is, that even despite that, it is so high on the causes of death. In the county, we're seeing that over the past month and a half, we've seen a rather rapid elevation in cases. Today at 44.8, we've been in the 40s for over a week now. We see our hospitalizations continuing to climb at our two county hospitals. Our ICU and hospital capacity is shown here, and that's been going up a little bit for the acute care and going up more so for the ICU. Same story in the state. We're seeing hospitalizations increase as well. And our percent positivity, so what percentage of tests that are done are positive, is also up and is around 8.5% at this point, above our target of 5%. Our infection rate, which tells us how quickly or slowly it's spreading, is at 1.17 and growing. An infection rate of 1 means that the case rate is going to stay steady wherever it is. The higher it is above 1, the faster it's spreading. And the lower it is below 1, the more it'll shrink. So this is not where we want to be. We don't want to be above 1. We actually want to get that under 1 so we're shrinking. We've seen that in the past 10 or so weeks, we've seen an increased number of deaths related to this case rate rise. And we see from our contact tracing data that are high-risk locations, the number one high-risk location is work outside the home, indoor retail, and indoor dining run neck and neck. And then the fourth and fifth are outdoor dining, which is typically fourth, and then outdoor recreation. So this is a summary of what I've just said. And critically, what we're seeing is that our state hospital capacity is what we're really concerned about at this point. We have emphasized the health issues of this, but there's also a burden that's put onto the healthcare system, and they want to make sure our hospitals will make sure that they can take care of everybody who needs care, COVID and non-COVID. Throughout the state, our baseline hospital capacity is about 9,000 beds, give or take. And during normal times, about 6,000 to 6,500 of those beds are filled up with patients. There are emergency plans in the state to increase capacity up to 15,000 beds, but staffing is a critical concern. There's only so many healthcare professionals to do that work. And frankly, when everybody in the country is struggling struggling with COVID right now, there isn't an easy place to find more staff. Everybody is looking for more staff. The other is that in order to do this, you'd have to defer or divert from other care. And that means that other people who have healthcare needs wouldn't be able to get their needs met. Importantly, about 70% of hospital admissions come from the emergency rooms. That means it's an emergency. It's got to be done right now. And there's been a lot of talk of elective procedures and deferring them. Hospitals really deal with the most urgent of those elective procedures. And when we're talking elective, we're talking about cancer surgeries. We're talking about putting in stents in hearts. We're talking about mending broken bones. We're not talking about things like plastic surgery or minor ailments, which really aren't done in the hospital setting. So I just want to make sure we understand what elective means for a hospital. Importantly, we also have some projections of what will happen based on our current trajectories, but also what's been happening in other states who've seen their hospital systems overwhelmed. In November, in early November, we saw that projections were an average projection of about 12,000 COVID positive patients in the hospital on our current trajectory by around February. Now, if you remember the numbers, that would overwhelm our system since that doesn't even account for all the other people who don't have COVID who need care. And that was one of the key indicators for us to actually act. On the shorter term, that orange line showed us what our hospital census in the state was doing. It was growing. And then that dotted line was, well, this is what happened in March and April and May. Are we going to trend along that line, or are we going to be less than that or more than that? So it was a way to see how good our projections are. But based on that, we knew that hospitalizations were increasing rapidly, and they would really exceed our capacity in early 2021. There's also this delay that happens. People become positive, their infection gets worse. About 80% of people do well, but about 15 to 20% have severe disease and require hospitalization. So the more cases you have, the more hospitalizations you're going to get. It's just going to be a 2-week delay because that's what we've seen. And then our hospital care has improved. So more people are recovering, but not everybody does. Some number of people do need to be in the intensive care unit, and then some number of people die from that. But there's a delay between each of those steps because of care that we provide. And I think a key point is that the effectiveness of our actions multiply over time. So if we act sooner, we save many more lives than if we act later. And we can reduce risk, but not eliminate it. So based on that, we took some actions in November. This was on November 12th. We decreased restaurant capacity to 25%. We decreased gatherings indoor to 10 and outdoor to 25, enhanced enforcement. And then, I think critically, we had our public messaging to make sure that everybody understood why we were concerned and why not just we needed to act, but why people needed to change their behavior and take less risk. And so a lot of that focus was on individual action. And specifically, when we talked about the restaurants, this is the data that we see. This is data from July to November that shows that indoor dining and outdoor dining were the third and fourth most likely places people who were positive. And that's the same data that we see in Maryland as well. This is contact tracing data that's available on our website and on the Maryland Department of Health's website. And critically, we also looked at the scientific literature, a CDC report that shows that people who were positive were 2.4 times more likely to be at a bar or restaurant than people who were negative. Scientific paper in Nature that showed that restaurants have the largest impact on infections. From our data, we saw that in Arundel, 2.2 times more likely, people who were positive, were 2.2 times more likely to be in a bar or restaurant than at a retail location of people who were positive as well. And so I've just included, and we're going to post these slides afterwards. So I've just included links to the contact tracing for both our county and for the state for those who want to take a look at that data. And particularly as we get into the winter months and colder weather, there's been a push towards outdoor dining. And one of our concerns is that enclosed tents really function as indoor spaces, but without an HVAC system or an air circulation system. So it's worse ventilation. So we made those changes in November. We see our projections, and we see that it has had an effect. It has brought down those projections to 9,000, but it hasn't had enough of an effect to avert what really would flood our hospitals. I mentioned that we looked at where we were on November 9th, and we see that our cases really tracked along that path that we saw in early April. The difference being at that time, there was a stay-at-home order, right? And also the hospitals had cleared out a lot of the people who were in the hospital, deferring care that was necessary. We haven't done that now. So people are still engaging in a lot more activity than in the spring, and our hospitals have less capacity. And so it's just a different position to be in right now. And so that's really what led to our recommendations in terms of actions to take. We really need to target more systemic actions. And what are the drivers of spread? Different groups of people coming together for prolonged periods of time, an inability to mask or distance, and indoor spaces. And the more of those drivers you have, the riskier that activity or location is. So we wanted to target it to target these actions to make sure that we limited the economic impact on people and businesses. We know that's a concern. And to make it for time-limited periods, so lasting for 4 weeks, and then we reassess to see what the effect of those changes were. And this is a summary of what they were, and these are posted as well. And I want to show you something that I think is really important. Is one of the things we did is we looked at what Michigan did. Not just our county looked at it, but other counties in Maryland, as we were all discussing what we needed to do. And Michigan took a similar set of actions to ours on November 18th. And they had very similar case rates to Ohio at the same time, and Ohio didn't take those actions. And what we see a month later is that Michigan has really contained that spread. They've actually reversed it. They're coming down now. I made this slide a couple of days ago. That downward trend is continuing. Ohio, not so much. So that's really, I think, a clear signal that these principles, when you put them into action, are effective. They're effective in reversing that spread. And Michigan saw that there was a far smaller increase in hospitalizations over that time than Ohio did. Which is what we're talking about. How do we keep from flooding our hospitals? And so I'm going to stop there and just acknowledge a few folks who helped us think through this from Hopkins, Dr. Josh Starstein and Dr. Tom Inglesby for their recommendations, and Dr. Klein and Dr. Lin for their projections.
Thank you, Dr. Kalyanaraman. Greatly appreciate it. Before we hear from some of our panelists for a few words and begin the discussion, I'm going to hand it over to the County Executive for some opening remarks. County Executive.
Thanks, Matt. Thanks, Dr. Kalyanaraman. That was really comprehensive and well done. A really good argument for the science behind what restrictions that we've put in place, some of which are in addition to what the state has in place. And I guess I want to back up a little bit and talk about some recent events that have put a little bit of a wrench in our plan to push these numbers down. I want to reiterate that the metric that we're looking at this point really is the one that really matters, is hospitalizations. And so we have projections from Johns Hopkins of what'll happen in our hospitals if we do nothing, what'll happen if we do something, and particularly the bars and restaurant closure is the one that they say is the extremely effective method. And the reason for that is that bars and restaurants are the only businesses where people are allowed to go and remove their masks amongst each other and spend an extended period of time. So that's the nature of the business. And all other businesses are required, people are required to have masks masks at all time in those businesses. So it's a very different situation. I brought together a group of Central Maryland, well, the Central Maryland County executives talk every week and have been every week during this pandemic. And we came together recently because there was a consensus among us that while state action is better because the virus does not respect geographic boundaries, that a number of us should act at the same time to further bring down these numbers. And so about half the population of Maryland, represented by Montgomery County and Prince George's County and Baltimore City and Anne Arundel County, all did that in recent days. Ours took effect yesterday. There was a case brought to a judge, and just yesterday, we were notified yesterday afternoon that there is a temporary restraining order against the implementation only of our restaurant closure or that part of our order. So all of the others are taking effect. That one, there will be a hearing, but not until December 28th. So one of the things that the Hopkins projections note is that the window to act closed, that that the impact of our actions today, we don't see in our case rates for a couple of weeks, and then the hospitalizations beyond that. So while the height of the surge that they project is about end of January, early February, and then as we get into the spring, of course, we have fortunately we have the vaccine, which is going to start bringing down for us the light at the end of the tunnel, the positive news. So at this point, we are not legally permitted to move forward with the restaurant closures. And my own comments on that are they're mixed. I spent much of yesterday talking to people in the restaurant industry, and I had been talking to some people who work at restaurants as well about assistance programs for our restaurant workers and the impacts of these closures on them. And I can tell you that signing that executive order was the most difficult decision that I have had to make since I've been in this office, and the one that I enjoyed doing the least, driven really by those Hopkins projections on hospitalization. So we can't take that action. The Hopkins projections suggest that just the restaurant piece of that has the potential to push our numbers down in the 20% range, which could make a huge difference in our hospitals. So we have to come up with other ways of pushing those numbers down. So I encourage county residents to do takeout, to support our restaurant industry, to not go inside for dining where the spread has been taking place, to limit their travel during these holidays, to limit their interactions with people outside of their pod, and to absolutely wear masks and social distance whenever they can, and to respect this virus. This is a last battle against this virus. And I know that we're going to look back on this time in this winter and ask ourselves if we did everything that we could to protect our healthcare industry, protect our hospitals, make space available, and save lives. So that's where that stands. As we move into the topic of mental health, I want to remind people of, this is not the first time we've had a session on this topic, and one that we had Dr. George Everly with us, and he said something that has stuck in my mind, and I've been saying ever since, because he studies disaster recovery globally. He's a global expert on the topic, and one thing that they have found is that as people emerge from whatever the disaster is and the stress of it all, sometimes it's coming out of it when the mental health issues emerge in a bigger way than even during. But what he said was that division delays recovery. So when you have within a country people fighting amongst one another as they're trying to recover, pointing fingers at one another, that delays that recovery. And that's an important lesson as we move forward. And there have been mixed messages about COVID coming from political leaders at various levels of government. And one thing that we can all agree on is that this virus is attacking all of us equally, and it doesn't care about our political affiliation. doesn't care who we are. It just wants to spread. And so everything that each one of us does is protecting others in our community. And even this decision by this judge, to me, it's simply an obstacle that we move around and we find another strategy to push these numbers down. I don't feel that we have any time or any energy available to be angry with each other, even about behavior. What we all just have to do is talk to one another, educate one another about ways to prevent the spread of this virus, and treat it as what it is, which is a virus, not created, not given to us by any person. It's just there, and we're all having to deal with it. But also, as we move into this conversation about the mental health impacts of all of this, I have to say that all across this county, I have seen so much goodwill and so many efforts in which people have gone outside their comfort zone to help one another. And I see it in county government. I talked about this a lot in the State of the County address a couple of nights ago, that the staff, the public servants, are creatively coming up with ways to do things that nobody thought we could do, that government didn't normally allow to provide assistance. And just creating all of these programs has been a joy to watch and participate in, and helping people, helping each other is what I believe we're put on this earth to do. And so there are opportunities for everybody to serve and to be part of winning this battle. And for me, that's a big part of the mental health solution is reaching out and putting yourself in somebody else's shoes and helping somebody. And as Dr. Caliana Roman often says, be kind. So with that's where we stand. And as we look at, move towards the holiday season, I'm really eager to hear from this great team of mental health professionals to talk to us about how to cope in this season.
Thank you, County Executive. Before we sort of kick off the discussion, we wanted to give each of our panelists a little bit of time to introduce themselves and offer some opening remarks. So we'll start with Adrienne Mickler.
Hi, good afternoon, everyone. Thank you, Matt. Thank you, Mr. County Executive. First of all, I echo your sentiment that Anne Arundel County is just a great place, and every Health and Human Service Department has really pulled together to help us stay ahead of our behavioral health needs during COVID. When I look at it from a system perspective and capacity, I'm really impressed that even during COVID, we were able to bring up quite a lot of different services. I look at Anne Arundel Medical Center was able to open at 16 inpatient beds. BW followed suit quickly with another 10 beds. We have pretty good capacity in our system. We have 44 mental health crisis beds, which is more than any other jurisdiction in the state. Our health department quickly stood up substance use crisis beds when we started getting safe stations off the ground, and we've got 22 of those, and there are areas of the state that have none. I'm very proud of that. And our whole behavioral health continuum is really sound. We've got partial hospitalization, residential programs, outpatient clinics, psych rehab, and a fair number of what are called boutique programs, which are grants that are specifically targeted to certain community needs. And all during COVID, we have been able to keep those operational and up and running. I have to say, COVID was kind of a catalyst for having us develop some, which were gaps in our system. And one is our behavioral health alternative shelter. And again, with the health departments and the county support, we were able to stand those beds up very quickly. And this is a service for some of our homeless residents who just aren't a good fit for traditional shelters. And it's really been critical for our crisis response system to be able to get those individuals into the treatment they need. I will say that the COVID restrictions posed some significant challenges in the beginning for our providers, but they really pivoted to telemedicine, which has just been an amazing response to that problem. And the speed that they were able to adapt was just impressive. We've been talking about that on and off for about the last 10 years and able to bring up different components of it. But it's just been critical to keeping our community safe and allowing for that continuity of care that a lot of our individuals need, and to expand access to care, which is also critical for us. When I look at some of the things we've done for individuals to relieve immediate stressors, I can't thank our partner departments enough. The COVID Health Line, they've taken over 65,000 calls, and just being able to provide information and support. Our COVID Care Warm Line, that's a one-stop shop for basic needs, food, eviction prevention, energy assistance, those types of things. And of course, our Crisis Warm Line, which is our 24/7, 365 number. And the extra support we got from the county to offer grief support for individuals who've lost loved ones, and provide other treatment options. I have to say, everyone in this county, and we know it, has been kind of hit by that COVID curveball, and provided a little bit of extra stress to all of us. So I thought now would be a good time to introduce Dr. Carney and let her give us some insight about some of that stress and how it's affecting our community.
Thanks, Adrienne. I'm Karen Carney and have had a long career as a research psychologist focusing on stress, health, and most recently positive psychology. I'm also an executive coach and do some work in organization development, like the Chief of Staff, Dr. K. Bagas de Bruin. Thank you, Mr. County Executive. I appreciate being here on this panel. I wanted to focus on the fact that this pandemic has been a problem which requires a behavioral solution. It requires us to act in new ways, think in new ways, and to overcome some of the incredible fear and stress and anxiety, and yes, even anger that comes from having to have our lives uprooted. So I ended up through Adrienne and her staff, thanks to Catherine Gray as well, working with Dr. Everly to develop a little program to provide a pilot project on psychological first aid, and we're working on implementing that. But working with Dr. Everly has helped us understand that the psychological burden of this pandemic can range from anywhere from 4 to 1 psychological to physical problems to 50 to 1. And so it has a lot of potential to have the need for our behavioral and mental health capability in this county to respond to people's needs. Now that we have not one, but 2 vaccines that are close to being implemented, I think that we can begin to think about how we can use 2 things that are really important to us as humans. One is we've evolved to be social beings. And if you talk to Dr. Everly, he'll tell you how important social support is to helping us have a sense of resilience. And the other thing that we can do from positive psychology is focus on things like hope. And it turns out that in our evolution, our brains were hardwired to have hope. And that means we can think about solutions in the future, and we can plan for those if we can move ourselves out of the anxiety and distress and depression and grief, and really begin to move toward a more thoughtful kind of way of thinking our way out of this. So thinking about a time when we'll have vaccines, thinking about how we can support one another. I myself have been involved in volunteer work with Anne Arundel, connecting together with the behavioral and mental health team. But I think the other thing that we can focus on are some things, one of which Mr. Pittman said that Dr. Kalyana Raman talks about, which is being kind. Kindness is important, but gratitude is important. So if we can think about the things that have happened in this pandemic that would have caused us never to think about how we can be grateful to our health officer, to people in our faith communities, to people who have helped us, those like Feed Anne Arundel, people who are helping others with food insecurity, helping others with finding solutions to the eviction threat. Those are the kinds of things that I think that if we can begin to shift our way of thinking toward the future, to have hope, while we certainly understand the challenges we still have, I think that gives us a way to look forward. And as a psychologist, I think that's where positive psychology as a science takes us. Now, we know that not everyone can do that. And so in those situations where people are overwhelmed, we go back now in more detail for some of the kinds of things that the county can offer. And I think, Catherine, that's where you're going to pick it up.
Thank you, Dr. Carney, and thank you, County Executive Pittman. So I wanted to talk a little bit today about sort of where the county is, what the landscape is of the county right now in terms of mental health. So we've actually been anticipating a behavioral health surge as soon as we started realizing COVID is here and it's here to stay. So preparing our providers, preparing our crisis teams to really be able to respond to a larger number of people needing behavioral health services. We know people are struggling. We know people are feeling very isolated. We know there's increases in anxiety and depression. One of the good things is people are starting to talk more about mental health. They're starting to identify the things that they're feeling, whether it's excessive worry, the fear of the unknown, and they're talking to each other about that. And that's a really good thing. That actually helps reduce the stigma associated traditionally with mental health services. The other thing that we're seeing is there's been an increase in the number of calls to our crisis warm line. So our crisis response system operates 24 hours a day, 7 days a week, 365 days a year. And we're seeing about a 20 to 25% increase in the number of calls. And that's actually a really good thing. It's not a crisis line, it's a warm line. It's a resource line. So people are actually calling in, identifying that they're having these struggles and are reaching out for help. Where can I get the services? So those are connections that are really important to make, because one of the biggest predictors of resilience in an individual is that early access to treatment, those positive relationships they have with each other. So these are all things, when we combine them, people are reaching out for help. People are talking with others about the experiences that they're having, which are very difficult. We're actually building resilience in ourselves, and we don't even necessarily know it.
Yeah.
Thank you very much, Catherine. County Executive, you want to kick off sort of the interactive discussion? You're muted, sir, sorry.
I have a question for all of you. How do we know if our stress is normal or not when the stress is coming from poverty, from not knowing how I'm going to pay my rent or how I'm going to pay my bills? I mean, that to me, it may be driving me, to do things that and act in ways that I never have before. But if I think it's, just give me $100,000 and I won't be stressful anymore. Which is it? Is it the money, or is it something else?
So it's really a little bit of everything. So we know that financial hardships, not having access to food, unemployment, those increase people's stress levels. But one of the things that that is important is understanding that we have a natural ability to cope with stress. So when we start looking at when my coping mechanism and those coping skills that I typically use aren't working anymore, I'm not able to function on a day-to-day basis, and it's lasting for more than a couple of days. That's problematic. That's really where we are asking people, please reach out for help. But even if it is that you're still able to cope with it and you're just kind of dealing with it on a day-to-day basis, having that external person to talk to that you can bounce ideas off, that you can vent to, you can share your frustrations to, is also really, really important. So even if you're still able to function, reaching out for help is still important when you are under that level of tremendous stress.
And I would add that it doesn't mean, because you're under such stress and anxiety, it doesn't mean that you're mentally ill. It means that something really terrible has happened to you. And so how you figure out how you're going to respond to that with some of the ways Catherine has mentioned and other people have mentioned really allows you to begin to take control of your situation. And we all feel better when we take control. But in the midst of change like we've had, I got involved in the work with Dr. Everly because I was concerned about the fact that chronic stress really takes a terrible toll on us physically as well as psychologically. So to the extent that you can begin to reach out for help, and you may have never had to do that before, and we hear people talking about that, but there are resources in the county and elsewhere to provide you with the assistance that you need. And I think you have to be willing, as we've heard some nurses and doctors on TV talk about, I've never felt this way before. I never knew that I needed help. I've been under stress through my job. And so the extent to which we can provide assistance through the county, it's also true that you can provide assistance to one another through social support that you give one another. And I think that's important.
So mental health first aid, and I guess I know all of you could answer this because it's a program that all of our police officers go through, and we've been trying to extend it to other staff in the county. But Dr. Carney, you're involved in a project that is sort of a pilot to get that work done in community groups. Is that right? And can you just describe what mental health first aid is?
So I will distinguish between mental health first aid, which is a different program that I think probably Adrian can describe well, versus psychological first aid, which is what Dr. Everly started to develop through the Johns Hopkins University. And it comes out of the disaster mental health field, as opposed to mental health first aid, which is more mental health intervention. And so that we've developed a little pilot project that takes psychological first aid as a first step, and then we do advanced training and we give people an orientation in applied positive psychology so that they can both help people respond to the immediate crises that they are encountering, as well as more in-depth training in resilience, social support, gratitude, spirituality, the kinds of things that are complementary to the basic psychological first aid model that Doctors Everly and Lading developed. And so we are making, we're working with Adrian's agency as well as Anne Arundel Medical Center to begin to try to just gently get this out there and see how we can work this in a way that will be complementary, so that if people are in trouble, as we said, most people are not mentally ill, but for the ones who need it, we act as a referral to the county warm line, to the crisis response center, and they'll be doing the same thing at the hospital. So we're just kind of a first entry point into the mental health system. And I don't know if Adrian or Catherine want to talk
Sure.
about
So mental health first aid is intended to be for the general public. This is how to identify symptoms or behaviors in an individual that may be experiencing some distress, And then it takes it a step further. So now you've done the identification, then what do you do? And it really is the next steps. How do I get somebody connected? How do I hold their hand through that process to make sure that there is that warm handoff, that they are able to reach out to a professional? And how do I help them with that? And your County Executive Pittman, you're absolutely correct. We're actually the first county in the United States to train 100% of our police officers in mental health first aid. This is something that no other department has ever done, but it was so important because so many of our officers are the ones that, you know, when people see somebody in distress, they call the police, and that's okay. But then the police can intervene, they can recognize those symptoms, and then they can call mobile crisis and we can intervene. And it really is a system that is working quite well in our county.
Excellent. We could all use it. Can you handle 570,000 people in the program?
Sure.
Because I think that's what we need.
You got it.
Who else here? We haven't heard from the other Dr. K or Pam Jordan or Nilesh. If you have questions or thoughts on this for our panel.
I'd like to go ahead. Thank you, Mr. County Executive. Pam Jordan with Health and Human Services in the County Executive's Office. We talked about financial stress, and I believe we have been extremely creative in taking our CARES Act funding and trying to lift the burden off of our residents who have lost income due to COVID, and especially during the holidays, which are typically the season of hope, and may not feel so hopeful right now, but I would just like to encourage people. We've set up multiple programs. We have one gateway phone number. If you are struggling to fill your fuel oil tank, pay your gas and electric bill, your water bill, are you facing eviction as a homeowner? Are you facing trouble with your mortgage? Do you need food? Do you need Christmas presents or holiday presents, however you celebrate this time of year? The gateway phone number is 410-222-FOOD 3663. We also are able to work with our health partners, Dr. Kalyana Raman's team. We're doing some critical case management to wrap services around people that may not be able to isolate or quarantine easily, to help them stay home from work and find a place to isolate or quarantine safely while we support the rest of the family with some of their basic needs. So there are a litany of services. I don't know that I've even touched on all of them, but I encourage anybody who is struggling financially, we still have time before our CARES Act dollars end on December 30th to support and lift up this community. Please call 410-222-FOOD. And we have, the beauty of that also is we have bilingual case managers and call takers, and we also have ready access to interpreters in over 300 languages. So we're standing by to help. Thank you.
Can I tell a little feel-good story?
Yeah.
Earlier this week, I went to the warehouse where Toys for Tots is getting all the toys ready to go out, and Pete Smith, who's a United States Marine Corps veteran, manages this for Anne Arundel County for the Marines. And it was as we were talking about the restaurant situation and the impact on restaurant workers. And so I got to stuff some bags. You know, you get the piece of paper and it says the family and how many kids and what age and what, you know, boy or girl. And you go over to the piles of gifts at different age levels, and you get to pick out the toys and put them in the bag. And so, you know, I turned to Pete and said, can you handle more? Like, you got 1,500 here. What about, is there any way you could get more? What about all these restaurant workers? And within 24 hours, Pete had created a portal for restaurant employees who were wondering how they were going to get presents for their kids. And we announced it yesterday. And as of today, there are 350 restaurant employees who've gone online and signed up to get presents for their kids. And just to see how, and the place was swarming with volunteers. and some of them were there from an addiction treatment center who were there with smiles on their faces. And just that scene and that quick action, and just seeing the way, one human being or a group of human beings can make so many families happy, kind of helped me out. Anybody else got any happy stories?
Mr. County Executive, I just want to say that I support what you're saying in terms of the staff coming together. I've been able to go to a number of distributions of the gift cards and the food distributions, and seeing the staff come together and do work that's probably outside their lane. They haven't done this work before, and it's really incredible to see how they've come together to really support, and also to see the numbers of people who are taking advantage of the program is really incredible. But I do have a question for our professionals on today. I am very interested in hearing what your thoughts are. If you have any advice for employers who are struggling to help their employees find balance, right? Because there's a number of employees that are struggling to manage, working from home or working out of home, and having to balance teaching, being a mentor, being a tutor, relearning math. I see that a lot. And also, just being able to take care of their daily, routine. Do you have any recommendations for how employers can help their staff?
One of the first things is be as flexible as humanly possible. I just think about our own staff. We have a lot of young moms with elementary age kids, and they're working from home, and they're trying to get their kids logged on to their Google Classroom, and they're, you're right, they're being the educator, they're being the mom, they're being the good employee. But if we can provide some of that flexibility for them, maybe some non-traditional hours, so that they can focus on, handling their childcare, raising kids, not really childcare, raising your children, while you're not fearful of losing your job because you have young children in the home, or you're, taking care of an elderly parent who's living with you. So, if employers can be as flexible as possible, that would be ideal. But the other thing is, if you have an employee that you are concerned about, either you can reach out to us directly, or you can give the employee our number and we can get them connected to services. The warm line is 410-768-5522. But we're also working on some pilot projects, which hopefully will be up relatively soon, to help with some of that.
I would say, to add on to what Catherine said, it's a very small thing, but it's surprising how much of an effect it has. For employees to take their staff aside one by one and say a sincere thank you for the work they're doing is oftentimes something that will fill that person up for a day or longer. We all need to hear that we're doing a good job. And so if the employer can take some time to think through what unique things that person has been able to do or contribute, that's a great way to help that employee. The other thing is that employer probably wants to build a cohesive staff, people who work together in the midst of incredible stress that people are going through at home, and you want them to sort of try to leave that at home and come to work and focus on work so that you can be really effective. Well, sometimes counterintuitive things like getting involved in a project to help people outside the community is a great way to build cohesion in your staff and give to others in a volunteer way that will make everybody feel terrific. So those are just two little thoughts.
Thank you. I was wondering if the panel could comment a little bit about the mental health impacts on our healthcare community, our nurses and doctors who are responding to everyone every single day.
Well, I can tell you that's the reason I got involved in the advanced psychological first aid program to set up a little pilot project, because in the springtime I saw all those doctors and nurses and mental health workers on TV talking about how stressed they were. And I've done a lot of work in combat psychiatry and with the military, with the Secret Service, and looking at the effects of work stress. And so I was very interested in the ways we could provide an immediate source of help to let people know that the stress that they were under was understandable, acceptable, but to remind them, as we can usually remind most people, that they do have some coping strategies that they've used in the past, that they know how to use, that they can apply to this situation, and thus make a plan and foster hope for the future.
Catherine, you look like you wanted to jump in on that too.
Yeah, so one of the things we need to remember is we do need to set up systems for our hospital workers, for our staff in general. Even if they don't use it, knowing that it's there and available if they do need it gives a sense of comfort, so you don't feel like you are completely isolated. You're the only one feeling this way. You know that on any given day, you might need to reach out to your EAP or your social workers on your staff, just to touch base with them and just kind of vent about how hard it is.
Mm-hmm.
Yeah, and I think that's exactly correct. And one thing we talk about is prevention. And so sharing tips and strategies to maintain wellness is also important, both just for everybody, but also, as an employer. I think we're more comfortable saying, take a walk, get up from your desk. But there's also like just a mental wellness equivalent of, find a moment to engage in thought or spiritual practice, or find gratitude. Just some small suggestions to maintain wellness, because part of it is not getting to the point where you feel like you just can't cope, right? And we're talking a lot about strategies to deal with it when you get there. But we also don't want people to get there if we can give them strategies to break that for themselves.
Thank you, Dr. Talley. We have a question that someone put in on Facebook, and we encourage others to as well. How can we help the mental health for our children with schools being closed, sports being closed, everything being virtual, everyone being in their bedrooms? What tips do you have for both children and parents to help their kids?
So for parents, one, understand how you're feeling about it before you talk to your kids. Really have a good, solid grasp on whether you're angry, whether you're anxious, whatever your feeling is, because that will get projected. As much as we don't want it to get projected to our kids, it does. But make sure that your kids are actually getting outside. I know it's cold, but just running around the block, getting a little sunshine on your face is a good thing. We prior to COVID, we always complained about kids and screen time, and now, it's kids and screen time, and it's an expectation now. But we still need to make sure they have downtime from that screen time. So whether it's cooking a meal together, or just even having your kids in the kitchen with you and talking about meal prep, or what they want for dinner, just sort of embracing some of those really simple things that traditionally we just sort of gloss through during the day because we're all so busy. But sort of relish in that, our kids are going to grow up and leave the home, usually before we want them to, but take that time to be with them. And parents, make sure you're taking time for yourself as well. You're on call 24/7. You're an employee, you're a parent, you're the housekeeper, you're the personal chef, you're all of it all in one day. And it's hard. So just make sure you are getting some downtime, even if it's locking yourself in the bathroom for 10 minutes.
And Catherine, something you said earlier I thought was really important to answering this question as well, and that is to try to be flexible. And Adrienne, we were talking yesterday, and she said, if your kids want to have pancakes for dinner, let them have pancakes for dinner. So we are in an upside down world right now. And so, change is hard enough, but if we can use this as an opportunity to be a little bit more flexible and say, yeah, you can stay up an extra half hour, that really helps the children. It helps you to kind of calm down. But I also agree that understanding what you're feeling. Am I feeling anger, anxiety, fear, upset? And understanding that with yourself will help you not project that onto your children, who will pick it up.
Mm-hmm.
And I think setting realistic expectations. I mean, Catherine went through the list of everything that's expected of stay-at-home parents, stay-at-home teaching all in one day, and it's not going to be perfect, and it's okay if it's not perfect. I think children will take happy over perfect any day of it, so just give yourself a break and congratulate yourself for making it through a day. And everyone had dinner, everyone, homework was done mostly. Just go for the small victories at some point.
Thank you, Adrienne. So we've got about 5 minutes left. And I want to make sure the county executive has a couple minutes at the end to close this out. So I wanted to ask each of our panelists if you had any closing thoughts from the discussion today, or last bits of advice that you'd like to give to those watching. Dr. Carney?
So I would say, try to challenge yourselves to come up with new ways of celebrating the holidays. We can't do it the same way we have. So what kinds of creative new ways can you and your family come up with to reach out and be with other people that you love during the holidays?
Thank you.
Mm-hmm.
Catherine?
I'd say cut yourself a break. Be kind to yourself. Be kind to others. I totally agree with Adrienne. Being imperfect is the new perfect. It's just who we are right now, and it's okay.
Thank you very much. Adrienne?
The clinicians here have trained me well. Be kind. It's the holidays. Try to enjoy and just, take a moment and enjoy.
Thank you very much. Thank you, everyone, for joining us. County Executive, do you want to give your closing thoughts on today's discussion?
I would just say that keep the phone number handy. The 410-222-FOOD. I'm sorry, what is the worm line number?
410-768-5522.
410-768-5522. And if you just write it down, you don't have to use it, but you might need it later, and then you'll have it. And it's I mean, what I express gratitude for is because I know that's a healthy thing to do, is that in Anne Arundel County, you can call one place and you can get referred to what you need. And so we are literally paying people's bills right now. Not all of them, obviously, but you can get somebody on the line who can help with not just your mental and behavioral health problems and issues, but also your financial ones. And that's thanks to the CARES funding that we have. And it is just what I've said is that during this pandemic, keeping a roof over people's head and food in their stomachs is something that we just cannot, we cannot abandon people in those areas. So we're going to do everything that we can to help. It's top priority. So thank you all of you for your wisdom and your optimism and your positive energy.
Thank you, everybody.
Thank you.